Welcome to the lure of temptation. Each story is a personal encounter with weakness, through which each person will rise up to escape the traps of temptation around, and today we come to the topic. What should family do when a loved one is addicted? What would you do if someone you love is slowly disappearing into a world of lies, debts, and despair? Gambling addiction doesn't just destroy one person, it tears families apart, quietly and painfully. But there is still hope, and in this video we'll show you the first powerful steps you can take to help them before it's too late. When a loved one falls into the grip of addiction, families are often thrust into a world of confusion, fear, and heartbreak. They watch someone they care deeply about become consumed by substances or destructive behaviors, and feelings of helplessness, anger, or guilt can take hold. In these difficult moments, it's crucial for families to understand that their role, while not simple or easy, can be a powerful force in their loved one's journey toward recovery. How a family responds to addiction can make a profound difference, both for the person struggling and for everyone affected by the situation. Understanding addiction is the first and perhaps most important step. Addiction is not a moral failing or a simple lack of willpower. It is a complex disorder that affects the brain, involving changes in behavior, motivation, pleasure, and impulse control. Substances like drugs or alcohol interfere with the way nerve cells normally send, receive, and process information. Over time, these changes become deeply ingrained, making it extremely hard for an individual to just stop. Recognizing addiction as an illness, rather than simply bad behavior, is critical for providing compassionate and effective support. Often, families wrestle with the question, why can't they just quit? The answer lies in the fundamental changes addiction causes, altering priorities so that seeking and using the substance becomes all-consuming. For the addicted individual, what might look like selfishness or carelessness from the outside is, beneath the surface, a desperate attempt to avoid withdrawal or uncomfortable emotions. Understanding this can help shift the family's focus from anger or blame to empathy and action. With this perspective in mind, it's important for families to educate themselves about addiction. Read books, attend community meetings, or reach out to professionals who specialize in addiction treatment. Learning about the signs, symptoms, and progression of addiction allows families to approach their loved one from a place of knowledge rather than confusion or fear. It also equips them to recognize enabling behaviors, actions, however well-intentioned, that shield their loved one from the consequences of their addiction and may unintentionally prolong the problem. Enabling can take many forms: giving money, making excuses for behavior, bailing the person out of legal trouble, or covering up negative consequences. Families often act out of love or a desire to spare their loved one pain, but confrontations with the reality of addiction are sometimes necessary catalysts for change. Instead of enabling, families should encourage responsibility and set clear boundaries. This doesn't mean withdrawing love or abandoning the individual, but rather communicating expectations honestly and enforcing consequences consistently. Open and non-judgmental communication is another cornerstone of effective family support. Addiction is shrouded in stigma, shame, and secrecy. Loved ones may feel attacked or cornered when their behaviors are confronted, so it's important to approach these conversations from a place of compassion. Using I statements instead of accusatory you statements can help reduce defensiveness. For example, saying, "I'm concerned about your drinking and how it's affecting our family," is likely to be received more openly than, "You never stop drinking and you're ruining everything." Families should also express their feelings and boundaries clearly. If certain behaviors are unacceptable, such as using substances at home or bringing dangerous people around, they must communicate this firmly. Family boundaries are not about punishment, but about safety and self-respect. Establishing what is and isn't tolerable is key to preserving the well-being of the entire household. It's natural to want to fix the problem or to try and control the addicted person's recovery. But families must remember that change must come from the individual. Loved ones can play a supportive role by encouraging treatment, providing emotional support, and expressing hope for recovery. But ultimately, they cannot force sobriety. Some may resist help, insist they have things under control, or deny there is a problem. In these cases, families might consider staging an intervention with the support of a professional, such as an addiction counselor or interventionist. Professional help is often necessary. Addiction is a formidable opponent, and its roots can run deep, impacting mental health, family dynamics, trauma, and more. Treatment options range from outpatient counseling to residential rehab. And the most effective care often includes therapy, medical support, and peer support groups. Families can assist by researching treatment providers, offering to attend consultations, or helping navigate insurance and logistics. Perhaps most importantly, they can maintain hope and encouragement, reminding their loved one that recovery is possible, even if the road is long and winding. Family members also need to care for themselves. Living with addiction can be exhausting and emotionally draining. Guilt, anger, fear, and resentment are all common, and over time, these emotions can lead to burnout. It's not uncommon for families to neglect their own needs in the process of trying to save their loved one. Support groups like Al-Anon or Nar-Anon offer community, guidance, and a safe space for family members to share their experiences. Therapy can also be invaluable, providing tools to cope with anxiety, grief, and the complexities of loving someone with addiction. It may be necessary to revisit and renegotiate boundaries over time. Recovery is rarely a straight path. Relapses happen, and progress can feel painstakingly slow. In these moments, families face difficult choices about what kind of support they can continue to offer. Sometimes, maintaining a relationship is not safe or healthy, and separation becomes a painful but necessary choice. Families must remember they are not responsible for someone else's recovery. They can offer love and support, but they cannot do the work for their loved one. Throughout it all, families should strive to hold on to hope. People do recover from addiction and go on to lead fulfilling and meaningful lives. The journey can be rocky, but every step forward, no matter how small, matters. Patience, compassion, and consistent support can make all the difference. In the end, when a loved one is addicted, families have the opportunity to be a steady, compassionate presence. By educating themselves, setting clear and loving boundaries, seeking professional help, and taking care of their own emotional health, families can foster an environment that both supports recovery and protects their own well-being. The path ahead may not always be clear, but with empathy, patience, and determination, families can help guide their loved one and themselves toward healing and hope. If this message spoke to you, you're not alone. At the Lure of Temptation, we believe in second chances, healing, and stronger families. Don't forget to subscribe, share this video with someone who needs it, and remember, even the darkest moments can lead to light. Your strength, your support, it might just be the reason someone finds their way back.